I wanted to, first of all, thank Chabad on Call, and a month ago, the Zalman Teitelbaum from Chabad in the medical community at Einstein. He had called me and asked me if I would be able to share some insights with the shluchim at the annual Kinus. And I told him it would be an absolute covet to help out any way we can. So this way we could, work together. And I welcome everyone here to join and work together with us. We're here to help. If we could be a resource of help anywhere, whatever we can do. And I hope what we'll reflect on today will, Bez Hashem, be something that will be able to help you in your various areas where you're doing your shlichus and to help the Gans Club. I wanted just to open up, being here is also, and I see, the various shluchim that are here, and I benefited from working with a lot of the shluchim. But there's something special, and I wanted to share. I figure it'd be appropriate if we just shared an idea from the Rebbe's Kusi Yagin Aleinu. He says that, when it comes to this week's parsha, we talk about Korach, and Korach was saying, so everybody's Kaddish. So why are Moshe and Aaron getting the covet? Why are they getting the areas of leadership? It's, everybody's Kaddish. Everybody should get the same amount. That was the question that Korach was asking. The Rebbe explains is that when you're talking about somebody that's a leader, and a person, you have to, as a leader, you realize what your kochos are to be able to use your strengths and talents to empower others to help bring out the best in them. And I believe that is what is the message that is brought by every single shliach that's here today, be it in person, be it virtual, or whoever's going to be watching this. But the truth is, this is the message that the Rebbe sends out, and this is our being able to fulfill the shlichus of the Rebbe, to go and to empower others and to show everybody as leaders, because each shliach is a leader on his own right, to go out and to be a role model, what Yiddishkeit's about, the beauty of Yiddishkeit, and to help people connect to that Nesara, even if it's going to be, what was that, even if it's going to be with that sha'achas, that you're going to go out and make that difference and help a person be koina his olam. That in itself, that's a leader. That's like a Moshe Rabbeinu. That's what as the Rebbe explains, that's the idea of being able to empower others through modeling and being a role model. So I wanted just to open up with expressing my hakaras tova to all the shluchim here, and it's a big chizuk for me to be able to be here as well. The topic that I like to talk about today is a couple of practical things also that have to deal with end of life in a sense, and the questions about what happens at end of life and some of the challenges that we face when we're dealing with end of life questions. It's not even as much the medical side. The medical side, generally, one of the questions that, especially if there's a family that's coming in, the Shomer Torah mitzvahs always ask them, who's your Rav, who's your posek? And one of the big things is, especially if you have a family that has a number of children or what have you, I say Rav, because if you don't have that Rav or that one person, that go-to person, you're going to have a number of people getting involved, and a different sheet is here and different sheet is there, and it could go make a whole crazy and the hell of amongst the medical team. So we always try to encourage families to designate a Rav for those that, work in communities that work with a Rav like that. Otherwise, very often, we're the ones who are the ones that might be serving as the Rav for this individual. When the questions come up, for example, do not resuscitate. And that's a very big question, the DNR, because a lot of places you find that the hashkafa is when there's the person signing a DNR, sometimes the hospital might take that as a DNT, do not treat. So every medical decision is a major shaila that has to come up. So also, I know for myself, I have a network of rabbanim. When shilas come up that I would need to ask, Baruch Hashem, a lot of the shadows don't come up so much behind her, but when they do, we know who we're going to. Very important is to, I sent out a bunch of packets. One of the things, though, that I wanted to show is, of course, the Halacha living will and the Halacha healthcare proxy. So we all know, of course, that, with the healthcare proxy, what the role of the healthcare proxy is. And in terms of being a healthcare proxy, we're trying to figure out what the patient would want. But of course, you always want to do that through a lens of Yiddishkeit, if possible. So it's always important, if you can, if a family is open to it, they would sign a Halacha healthcare proxy. So this way, when the doctor has a question, you can work together with the doctors and the Rav on the phone. I'm going to tell you a mitzvah that happened a number of years ago. We had a patient that came in, he was about 63 years old, he had prostate cancer, and when they come to our hospital, they're called palliative care, it's end of life care, but sometimes the other facilities, they don't present the full picture, and the family's assuming that the patient's going to get well, they're going to get the rehab, they're going to get home, they're going to get better. That's not always the case. And we had a shiloh one time where the doctor had to recommend to stop the IV, and stopping the IV is something that's a very sensitive issue, because of course you want to give hydration, you want to give nutrition, of course oxygen, all these things that are very important. And the patient, believe it or not, he was, just to give background, he was blind, his mother was Niteris, his uncle was he was a healthcare proxy, and he says, I want to ask my Rabbi Shiloh, I want to know what we can do about stopping the IV or not. So what happened is that we tried to get through to the Rav. It wasn't available. So we asked the uncle, there's another Rav that we can call, would you be comfortable with? And he was. So we got him in touch with that Rav. That Rav also happens to be a doctor. And literally I spent maybe 15, 20 minutes on the phone reading the chart to the Rav. What medications this patient had. Did he have Lasix? Direct to get the water pill, to get the water out because he was filling up with fluids. And if they kept the IV going, this might be an aspiration pneumonia risk and things like that. After 20 minutes of discussing all the pratim of the case, the Rav said it would actually be appropriate to stop the IV at this point in time because it's more of a sakana to the patient than if you were to keep the IV in. And questions like this, because people are not aware of the issues that come up. And I feel that one of the roles of the shliach or the chaplain or the Rav who's there in the hospital, very important role, is that we're the people on the front lines in the sense that we have a little bit of medical understanding and we know how to field the shilas and have and explain to the family. When families call me before they come in, I go over a number of shilas that they can ask or what shilas they should ask before they come in, what procedures they should do, what they shouldn't do, and find out what the patient's condition is. I find that this is very important because then this avoids a lot of issues down the road. So the role, or one of the roles of the shliach, which is extremely, extremely important, is that being on the ground in the hospital and having a little bit of the medical terminology down, being able to explain things to families, explain things to the Rav, being able to interpret, and also to speak back to the doctor that we can speak their language. And I can tell you when we have family meetings and I'm sitting down with the doctors, I'm going to tell them they're going to look for X, Y, and Z. See what you can do to do X, Y, and Z. This particular treatment, can that work? Because this is exactly what they're looking for. And how can we think sometimes outside the box to figure out how this can work? So that is one of the roles of the shaliach, which I find is extremely important, being that liaison between the medical staff, the Rav, and the family. Because also often, if you think about it, when a family is in crisis mode, are they thinking rationally? Generally not. So this way, it's a voice of reason. It's a way to be able to get everything out on the table and all the details or whatever needs to get done. So this way, everything is done. Kedas Kadin, you give the utmost coverage to the patient, you give the proper medical care to the patient, you can make the medical staff happy, and also that the family feels that they are at ease, knowing that they have somebody on their side that's working with them and that speaks their language. So you're the intermediary. between, literally the shliach in between both sides. So that would be one thing just in terms of halacha healthcare policy. I want to talk about, we're going to talk about also today a couple of things. I want to talk about preparing an iftar and some of the things that we've implemented in our facility, things that you might be able to implement in your facilities. But also, I want to talk about some important documents, important planning things that can happen. I've had this experience once too many. We actually even had this experience this week. There was a patient who came in her 90s and non-responsive, nonverbal, no family. The lawyer doesn't even know where her will is. I'm waiting for a call back from him to find out where it is. What do you do with a patient like this? So maybe they had funds, maybe they don't have funds. It's also, especially when important to know that when a patient is nifter and nifteris, power of attorney ends, healthcare proxy ends, their money is basically frozen once the Department of Health gets that death certificate. So nobody's going to be able to get money out of their bank. And I remember we had this once with a family that the friend still had the debit card. I said, but the death certificate was signed. You're not going to be able to get anything out. Even if you had her permission beforehand, now the money's frozen. You're not going to be able to do that. And then comes the cost of a levaya. So, two things. One is there's a very important form, which is the agent of disposition of remains. I don't know how it works in every state, but I know for sure there's one here in New York. And this form, this agent disposition of remains, I did send that over as one of the forms in the email, is a form that basically the person, the patient themselves will say that this individual, they are designating a certain person to take care of their levaya arrangements. Now, if you also go on the NASC, National Association of Hebrew Kadisha by Rabbi Zone, his website, they have also the MS card, which is also something which is very important. The MS card would be also discussing what a patient's advanced directives are. Also, within the website and with the MS card, also it discusses, there's something that tells, which designates what the patient would like to be done with them, what their disposition of remains would be. Hopefully, that should be a kvura. Sometimes you're dealing with cases where a person, the good thing is that the law is unless it's written somewhere down and if there's no family, so you have to bury the person versus cremating. And I know, we've been working, we've had a case in the past where the will was not able to be found, but the lawyers were looking for it. So this way the lawyer could be considered the executor. And at that point, if he's still considered the executor, then he can go through with the cremation. So in a case like that, you daven that you don't find the will. So then hopefully the person can have a proper kvura. But with this disposition of remains form, this way, if you have a kesher with the person or a kesher with the family, or and they're not able to do it, it's basically for somebody really that doesn't have family, or the family's not involved. So like this, you would be able to make sure that you are the ones that are in charge of the kvura at that point in time, and you can make sure that the person will get an appropriate kvura.
Sorry to interrupt you. When there's no will, and whoever is in charge says that I have an oral will, and I have the will somewhere, you can't consider that you can bury quickly?
Usually, no. It has to, if they're gonna pay for it.
If you pay for it.
Right, if you pay for it.
Yeah, can I bury it 1, 2, 3?
You could probably do that, because we had a case like that.
I did it, but I want to know if we can legally.
Legally, well, what's gonna happen, I'll tell you what would happen, very quick, because when somebody has no family, usually the public administrator gets involved.
And then?
So once the public administrator determines that there's nobody to do it, then they give their green light. That's really the legal way. Like, for example, one of the things also, I'll go a little bit out of order because it's coming up anyway, but like, for example, Hebrew Free Burial Association. So we work with them all the time. And when they don't have, sometimes here's where the issue comes up. We want to do a kvura as soon as we can. This was a case that happened to us about 3 months ago. The nifter, his balabas, his landlord, was an Halacha person from Borough Park. I wasn't from, not any family. Apparently, there was some cousin. Now, they were going through, we didn't know what to do with him without Torah, so we decided we'll go through Hebrew Free. Hebrew Free said to them, let's wait for the public administrator to get involved. So this way they'll see if there's money, they'll see if there's a relative. The main thing was that the public administrator, should they find a relative and they'll say, no, they wanted this or they wanted that, they're gonna make a whole rush about it. So that's why they would say, go to the public administrator to make sure that there is nobody involved. And then this way, everything is 100%. What they decided to do is they went to Hebrew Free and they paid the full price for the Leviathan. Their price, I think, was $3,200 or something like that. They paid it themselves. They said, no problem. Let's go ahead and let's make sure this person gets the Torah right away. They went ahead and they did it. So it turns out they didn't, I don't know if they did the full investigation with the public administrator. They probably did. But this person that was quote unquote a cousin wasn't even a cousin. It was just some guy. He said it was the guy's cousin. So and as the landlord said to me, nobody's called. And I remember he called me Taka on the it was about the Shloshim time. He called me on the Shloshim and he said to me, nobody has reached out to me at all, giving any key detail about this individual. So at least we know that it was done Baruch Hashem. There was a question about getting some property from the hospital, whatever it was, but nobody even called. I mean, that's the risk that you run into, but they would get the public administrator involved, and once the public administrator gets the clearance, so then they would give the go-ahead for the Torah. But I guess if there is money, they would still allow for the Torah to go through. It would be paid for, so this way it could be done more expeditiously, because otherwise, if there's nobody else, it can take up to a week or two till they finish. They go to the apartment, they do the whole dance chef. That's what they would do. But
the money, I understand the money from the public administrator come months later.
It can come months later, but what Hebrew Free would do, they're okay with it if they get paid later on. So for example, so like in this case where I have this lawyer, he said to me, he doesn't know if he's gonna want to lay the money out because he knows that even if she does have a will and gets probated, it might take 2 to 3 years for them to get the money back. Also, when people in these situations, like, let's say you have a Hebrew Free case or something like that, where somebody was saying that they wanted to cremate, and Hebrew Free would get involved, they would say, okay, we want to cremate. One of the ways that Baruch Hashem were able to work that out is that Hebrew Free is not going to take anything up front. And we say to them, look, if you want to spend the $2,000 now, and you have that money that you want to get this person cremated, gives them the hate. Go right ahead and spend the money. Once they hear that, they sometimes, and it's happened, Baruch Hashem, that they turned away from it. And this way, they were able to go ahead and we were able to do the Torah that way. We started, we actually got a grant at our hospital. This was in February of this year. I had met this shliach who's in the South Bronx, and we met together with him and one of the landlords in the South Bronx, and we got together. Apparently, there was a patient from one of his buildings in our hospital, and there was a whole court case back and forth between the lawyer, the exec, whatever it was. Now, the lady ended up getting cremated, but the landlord called me up and said he wanted to meet with me. Turns out he down shul with him sometimes. And so we met together with the shaliach, the landlord, also with Rabbi Shem Tov from Riverdale, and Rabbi Zone. We met together. We also had another meeting with Rabbi Bayer from the Chabad Kaddish Square. And he said to me, listen, all of us, when you have a case that somebody wants cremation and they can't afford a burial, call me, and we'll help you out. So to date, we've had about, since we started working with them, I think 13 people. We started last May, and about 13 people, Baruch Hashem, have had Fura with Tahara and everything Kadasa for them to help. We were able to arranged through this grant, from the Myerson Foundation, that what we try to do is we'll give money per person, depending what it is. So I have 4 different people that I can call now to help out with the same mitzvah. And we give about between $1,500 and $2,000 of our own from our grant per family, depending on what they were going to do. Sometimes the families, what they'll agree to. I'm going to tell you, just if you don't mind, I'll throw 2 stories over how we Baruch Hashem been able to help with this. One of them is, there was a lady that was 102 years old that came to the hospital. Her son lived in Colorado. He wasn't coming to visit himself and his own health problems. When I called him up, I asked him, so Lachemir Vesser, what's going to be? So he said to me, she has a plot in New Jersey in Cedar Park, through United Hebrew Communities. So he said, what we'll do is we'll cremate her and then we'll bury the ashes next to his father, next to her husband. I said to him, why do you need to bury the ashes? Why don't we? I said, is there a problem with money? Turns out that she had a home health aide who stole from her $150,000. And Baruch Hashem, they caught this person. This person is actually in jail right now. They caught her, they gave her a year to pay back. She never paid back. And so he said he's limited. Now, look, he cremated his wife. So I said, what if we help you out? So what were you going to pay for a cremation? He says, tell me what a cremation costs in New York. I said, how about $2,000. So he said to me he was going to give me he would pay $2,000. And then I said, I'll get the rest covered. So I made a number of phone calls. Baruch Hashem, we got everything covered. And then, not only that, after Dr. Mir's issue was Nifteris, I had spoken to a friend of mine who's a Rebbe in one of the local yeshivas, and I was the only one that showed up to the Slavaya, but I got 12 buffers came, and they came, and we did the Torah, the Das, which they did. We were able to help her out through our fund, through this outside source of help, and Baruch Hashem, that worked out. It's also important to have connections in different states. And I'm going to tell you why. A patient came in to us, nonverbal, and it only listed a friend as his next of kin. So I reached out to the friend, I gave her my number, I told her who I was, anything we can do to help, no problem. I'm leaving my office that afternoon, and I get a call from this lady who tells me she's his niece, the patient's niece. And what happened is that she's telling me a little bit about her uncle, and she says, by the way, the patient's sister, this niece's mother, is on hospice in Florida right now currently, and she's not doing well. So I had asked her, what are his funeral arrangements? So she said he apparently made some type of arrangement. So I was looking around, I was hoping to see what it was. Turns out he had planned for himself a military burial without a tahara. So at least it was a burial. But here's where we worked it out. So she tells me what's this matzah with her mother. Her mother had a grave here in, I believe it was Beth Moses in Farmingdale. And she said to me, I don't know what to do because I can't afford to get her up from Florida to New York to do the Torah. I'm going to have to cremate her and send her up. I said, would you mind if I asked you a personal question? What would you do if I could help you out financially? If I can make it work, would you be interested? So she said to me, okay, but I'll be interested, but see what we can do. So I first called Rabbi Zon because I know he has the South Florida Jewish Cemetery and his liaison out there, Rabbi Yaakov Lyons, in Florida. I spoke with him and asked him, asked him what we could do. So he told me about the cemetery down there, but then he gave me the name of Rucham Kappelman, who runs, I believe, the Neshama burial service out in Florida. Good person to know. He told me straight out. He said, this is the price, what it costs to ship a nifter or a terrace up from Florida to New York. If they could get me anything of $1,000, it costs like $2,600 to do it, that's what they charge. But if you do it for $1,000 or any part of that to stop a cremation, I'll take it. So I got this far. So I called the daughter back, the niece of our patient, and I said to her, look, she is, I have somebody that's ready to take us up from Florida. No problem. So then she said, what about the arrangements? So who's going to pick her mother up at the time? So I called Jerusalem compliment back, and he said, I'll take care of everything. And then we worked out the money. I called Rabbi Bayer from Square. I said, would you be able to help me out with the next mitzvah? He said, we did it for the next mitzvah price of $1,800. The compliment we got him to do for $1,000. So the daughter gave a little bit, whatever she was able to do, got the grave opening covered, all the money was covered. By the time I called her back to let her know that everything was settled, this was a matter of 45 minutes or so. She tells me she just got off the phone with the hospital in Florida and one of these things. So I had to call Yerucham Compliment right away. She called him. It was too late to fly her out Thursday night. So Friday morning, she was on a flight from Florida. Rabbi Bayer met them at the airport about 11:30ish. And I called a group that I know to help make a minyan. I wasn't able to get out to the cemetery myself. But a minyan arrived at the cemetery. This person, this niece's mother, our patient's sister, was buried Kedas within the minyan. They FaceTimed Levaya. She was able to take part of Levaya. She also goes to a Chabad down in Florida where she is. I believe it might be near Boca. I forgot exactly where she is. But, when the shliach there gave her a yahrzeit candle and helped him out in terms of Shiva and everything, whatever they did of Shiva. But her mother had a proper floor. I want to fast forward 2 weeks later. So her uncle's still the patient by us. So I found out which funeral home they were going through. And I was talking to her. She said, you can thank us more than what everything was done. I told her also help her down the road to my saver, no problem. So she said, what can I do for you? I said, can we make sure your uncle has a tower? So even though he's going to be buried in the military cemetery, can we make sure that happens? So she said, do whatever you need to do. I'll do whatever you need to do to make sure. So 2 weeks later, when he was nifter, both he and his sister, 2 weeks apart, with the tears, or 10 days apart actually, something like that, they both were buried with Tahar and Chakri as best as can be. So we thank the Eibishter to be able to do this, and to be able to have funding, and connections in the various cemeteries. A very important thing is, especially if you're not in the New York area, wherever you are, if you have a contact with somebody in a cemetery or a funeral home, it's important because years back, people used to buy into societies, and they had burial societies from all different areas where people came to Europe, or postal workers, benevolent societies, all these types of things. There are so many graves that are not used or will not be used by these societies. And what happens is they go back to the funeral directors, and sometimes we're able to get funeral directors that will be able to help us get graves for maybe $500 or maybe $1,000, or maybe sometimes they won't charge for the grave, depending on where the location is or whatever it is. So then we just have to raise the grave opening, and then what it costs is to bury a Mace Mitzvah. So the area, $4,000 or so, something like that. So this way you would be able to know how to do that. It's good to make these sharon in order to do that. Yes.
I just recently had a situation where I think, how long is that? Because this money was 20%. You actually made homework. Nobody say that's very cool.
It's not critical, but the thing is, we do it as an extra, if we can get it, because Baruch Hashem, we have the resources to get them in young.
So it's not like no,
it's not market.
If there's not such a good nobody can publish to bring 10 people from there.
No, the thing is, and what I've been able to do here in the New York area, I have 5 contacts for Long Island Queens cemeteries. I have for northern New Jersey, and then I have north central New Jersey. So with most of the cemeteries that people are going to, we have a resource of a minyan nearby by each one. So that's why it's easier to do. People working in the area, etc. So then there's for example, in Long Island, 5 towns in Far Rockaway, there's Achiezer organization. One of the things that organization does is they provide minyanim by say mitzvah or things like that. So that could also.
You have to have results.
Wisconsin does also, yeah, Wisconsin here also would help out also. Wisconsin Queens wants help me with the crew as well. So we were able to do it. So
Family with me, they have to paper to
who's a
able, but you give them like $500 for that.
and he's able to do it. Okay. Well, Hashem. So all these were important resources. Now, what's important also when you're working with somebody, I mentioned the disposition of remains. There's another thing that is very important when you are planning a levaya or getting somebody the arrangements made. There's a sheet that the two forms actually. Now these could be with people with means, people without means. One of them is what we call the pre-arrangement sheet. The pre-arrangement sheet, this is what the funeral directors call the vital statistics. These are all the questions that they ask for the death certificate. So one of the first questions that is done, that is asked, when the funeral director is making the arrangement, even if you do it ahead of time, sometimes it helps out. So this way, you can get everything together and move things expeditiously. And I can tell you, I've had cases that we had a patient that was lifted at 6:30 in the morning on a Friday in January. I had the funeral done by 12:30 that day. So Baruch Hashem, because we had all the paperwork done in advance, all we had to do was call the Chabad Kadisha. We called in to get the grave open, and we were able to make sure that the funeral was done by 12:30 that day. This was also another case where we helped subsidize, and it was another case that the patient would have gotten cremated, but Baruch Hashem, it worked out beautifully. So Chasdei Hashem for that. So these are all the questions for the vital statistics. They ask the person's the name, address, date of birth, social security number, the latest occupation. A lot of these are just statistical questions. If you don't have them all, it's not ma'akev. Their highest level of education, but of course the social security is important. Their parents' names, marital status. Now, if they were veterans, the person's a veteran, so they're entitled to a military burial. Not the greatest, but there are, at least Baruch Hashem, it's better to have a military burial than no burial.
Is there shadows about military burial? If they do everything?
If they do everything, I mean, I had asked the Shiloh about it, that if it's not on Karka that's Mukdash for Yisrael, they said it's still better than not burying them. Because if they wouldn't be buried anywhere else. I had a case, mamish during COVID. It was over Pesach. The person was nifty. It was in one of the refrigerated trailers that we had for 2 weeks. When I came back after Yontif, so the family, they couldn't afford it. He lived up in the mountains, Sullivan County. And the Gadafka wanted to be buried in the military cemetery in Sullivan County. That's what he wanted. If not, they were going to cremate him. So I worked Baruch Hashem also, another great resource, Mendy Rosenberg, Professor Shalemes, between Mendy Rosenberg and Rabbi Bayer Square. We were able to get the person up to Harris Funeral Home. They did a tahara up there, and they ended up burying him in the military cemetery. It took a little legwork to do it, and we got the money together also, and they worked out a very reasonable price for them to take care of this, so Baruch Hashem. But that was definitely a shadow that I had asked back a number of years ago. If a person is going to be buried in a non-denominational cemetery, Goyim, Yidden, whatever it is that better than not burying them? And the answer that I was told, one of the I spoke to actually was dying about it, and he told me that it would be appropriate. It's better than not.
My Rav told me that I can't officiate.
They're different. I don't know, but like I know, for example, like I would, the people ask me to officiate at Levitis. If there's no tahara and tafridim, no.
That wasn't the issue.
Yeah. So here, the Jewish cemetery is not as much of an issue as more of the tahara.
Really?
Yeah. So.
So a person could have military honors and presentation of a flag in any cemetery.
That you can have, right.
Right, so that could even be in a Jewish cemetery.
That could be in a Jewish cemetery.
That's very meaningful, or whatever.
I've done that a number of times. I remember that, we've done it many a times, and, that they would go ahead and they would do the military honors. I mean, there's also other shilas also about tahara, sometimes we have to use this shara that, I've spoken to Rabbi Zone about it. And, sometimes families want to use the, clothing. Can you put it over the tafrichim? So I was told that it's b'diavad, but we could still do it. It's better than not getting it at all. I had somebody last week who was neftaris, the daughter was going to embalm her mother. And I said, why don't you do the tahara instead of the embalming? And then she wanted to wear the dress and the jewelry. I asked the child about the jewelry. I asked the child about, about they wanted the hair done. So the answer that I was told was that, yes, it's a b'diavad, but once they have the tahara and they have the tafrichim on, b'diavad, if they want to do that, it's going to prevent them from doing the things like, embalming, so then we would be able to do it. So you have to find where you're able to help out, or what you can do to squeeze things in, as best as you can. Another thing that is important, and that's this checklist over here, which is in terms of death certificates. Now, this biostatistics information and these death certificates, this is basically throughout the United States. It's basically the same information on any death certificate. This checklist tells the family how many death certificates are you going to want to order at the time. And that's an important question because later on down the road, it's much more difficult for them to get it. So we always encourage to get more at the time than later, because if they hold off on it, so then it's going to be much more of an outlet for the family to go ahead and get them. They're going to need it for banking, Social Security, whatever they're going to do, wills, insurance policies, retirement funds, anything like that, that they would need to show a death certificate. That would be something that is very important for them to know. And, I always tell them order more, because this way it's money well spent. If you have a couple of extra, 1 or 2 extra, no problem. If a person's a veteran, as Dr. Silverman had mentioned also, one of the benefits is that they get 3 free death certificates as well. Sometimes when it's a question of money, that would be something that can help out. So any little thing can help out. Before I get to actually preparing the mace, there's one other area that I want to discuss, and that's also Pur in Eretz Yisrael. Pur in Eretz Yisrael, there are a couple of steps that need to be taken in terms of preparing and getting ready for that. Number 1 is that the Calvary here requires the Ishur or the deed from the cemetery in Eretz Yisrael where the person is going to be buried. That's number 1. Number 2, the first question that we ask a family when they are telling us that it's going to be Pur in Eretz Yisrael, we ask them, is anybody going to be going with the nifter at the time? And do you have a valid passport? Because I remember when I first started working at Calvary, there was a patient that was nifter, and they were taking the patient to Eretz Yisrael, and his son didn't have a valid passport. So we got him an emergency passport. One of the pages I gave out is a place in Borough Park, easy passport in Bernbach. That's a place where people can go get passports pretty quickly, expeditiously. He ended up missing all the Hespedim here in New York, but he was able to get on the flight to be allowed his father to Pur in Eretz Yisrael. So one of the questions we asked the families, you needed to have a valid passport. If not, here's a way to get one and make sure you have it. Another thing is now, I believe since 2019 or 2018, the Israeli consulate requires the nifter to have a passport too. Why, I don't know, but you have to have that documentation. Another thing that has been since COVID started, the consulate also requires a letter from the physician or from the facility that the patient did not have COVID or what their COVID status was. So if the patient was negative from COVID, then there's not going to be a problem bringing them in. I don't know, I haven't, Baruch Hashem, had an issue with somebody that was COVID positive at the point in time, but this is also a letter that they require. If there's, they can't, but they wanted, but the Israeli consulate wants a letter that the patient did not have COVID, because they weren't accepting as far as I know, at the time when I was going, they went to
Someone's gonna introduce it.
that's the next thing. We have special boarding testing. So,
Patient, the patient very fast, doesn't have passwords.
so I guess if you can, even if you have maybe an expired passport, that might work. But what I would do is, once you hear Eretz Yisrael is the question, is the, whether they're gonna do the Pura, try to get the information. All the information that you're gonna need the vital statistics, the death certificates information, the passports, the deeds, the cemetery in Eretz Yisrael. Now, you can go to various people here, like I know in New York, there's Ari Mandel, he does it. He gives the gets the permits for various, for most of the funeral homes. Rabbi Byron Square does it, Shomrei Achomos, Shomrei Adas, and also Rabbi Folger and Borough Funeral Services, they all do it. So, and they get the work done. I'll never forget that I was working with Rabbi Bayer Square on a patient that was going to Eretz Yisrael. He says, call me when the death certificate's done. So Baruch Hashem, one thing in our hospital, the doctors do it right away. There's no waiting for it. So with that, I'm standing by the computer, the doctor, she just finished signing it. So I call Rabbi Bayer, he says, my guy's already on the way to the consult. She just turns around the doctor and gives me a look, you for real? I said, no, nobody wastes time. We had one of the patients was nifted at 6:30 in the evening. He made it on the 11:50 flight that night. So whatever needs to get done, Baruch Hashem, we're able to expedite and help out with that. But that's basically what you need for Eretz Yisrael. Also, I gave you a list of travel agents that would help with this in this situation. If the family doesn't have a travel agent, also I can tell you the Chevers have a travel agent. Also, if the family would need it in order to get tickets to be able to go to Eretz Yisrael.
It's really sure.
What?
They don't need it.
What? No, this is.
If they do first,
We're not. This is not. This is not even.
No value.
No, this is not the question. This is not. We're not supporting them. We're not giving them the additional money. We're helping them make the arrangements.
I said, well,
Funeral home can do it also, but to help when a family's in crisis mode, they're not thinking.
you want to do things for
Exactly. So if you have all of this, I can tell you, I fill these sheets out all the time. My father's Zechrono Livracha was a patient by us, and I knew things were not going well. We knew everything. We were going to do everything. I couldn't even make the phone call. It was too hard for me to do it emotionally. So what did I do? I took one of my papers from the office. I wrote out all the information. I faxed it to the funeral home that we were using, and I called up the director. I said, I just sent you all the information. You know exactly what we need to do. So a family in crisis mode is very, very hard to think about, especially when they're going to Eretz Yisrael, like who's going and how many are going. That's why we try to get the information. Once we know that they're going to Eretz Yisrael, let's get everything lined up. So that way, when it happens, it's a phone call, and then everything gets taken care of. And it's not, I've spoken to Rabbi Zone about this, pre-planning a levaya and getting everything in order is not an ayin hara in any way, shape, or form. I can tell you, my father's Zechrono Livracha was nifter on Erev Sukkot, and in the middle of the night, at 3 a.m. or something like that, because I had given all the information right away, he was able to be buried before Yontif, and everything was taken. We didn't have to wait 2 days, 3 days for a levaya. Within 7 hours of this period, he was buried. So it does help when you're able to have all the information.
Now, somebody who wants to be there as well.
Mhm.
How would you use our staff?
So what happens is, let's say, for example, Calvary Kadisha here, one of the people that I work with, Rabbi Bayer. So I know the price has gone up. That's the problem. It's about the era on our $8,000 to get the nifter over there. What he does is he takes care of the death certificate here in New York, the transfer here, the flight arrangement for the nifter, and then he also contacts the Calvary Kadisha and the cemetery in Eretz Yisrael. So that way, when the flight lands, so the Chevra Kadisha meets them at the airport and they go straight to whatever cemetery it is over there in Eretz Yisrael. The family though does have to arrange their own transportation from the airport in Eretz Yisrael to the cemetery. And then that's also that he has a list of travel agents, we have a list of travel agents if they don't have it. So this way we can get them on a flight if possible as soon as we can. Yes.
Okay, before you leave, I just want a summary. If the patient comes in conscious, how
Yeah.
many certificates, responsive, how many things do we need to sign with him? If he doesn't have immediate family?
If he doesn't have immediate family, the best thing to do is to sign the disposition of remains form. This way, you are the one that's you could be the one making the funeral arrangements, or you could be the one to make sure that the patient gets a proper funeral. So that means that by law, you're the one that's helping make it. What I would do though, if that's the case, I would, figure out to arrange with the funeral director, or if the patient is actually conscious and he doesn't have arrangements, I would see that you could work out with him if he's able to and he has the means, see what you can do to get the money, the funeral paid for beforehand. Because if you do the pre-plan, so then it's paid for and the money doesn't get frozen and you don't have to start raising money for the body. If the person does not have the money, then you could do like the disposition of remains. You could go through like Hebrew Free. Hebrew Free will take care of everything. They'll go through the public administrator. They'll do all the paperwork, no problem. They'll arrange the kura. That's all taken care of. If the person has a cemetery plot and they want to be buried in that cemetery, so then it's important to get a pre-arrangement and to work with one of the funeral homes to get a price, get the money in there if you can beforehand. If you're not able to, if the person doesn't have the money, they want to be buried in that cemetery, let's say it's with family, that's one of the reasons why we have our fund that we would give up to about $2,000. And then also I have a list of contacts in the community of people that would help out with the same stuff to make sure the person is buried.
So just to clarify.
Yeah.
Once they sign with full consciousness, they
Yes.
sign this certificate.
Yeah.
It's halachically, all the halachic, I can do all the halachic procedures.
Yeah, because the person is basically saying, you are the Baal HaBas to make sure the funeral arrangements are made. Whatever, you could either, if you speak to the person, tell him, this is what we're gonna do. And when he signs that, he's masking to what you're saying.
What if the patient is not responsive, no next of kin, et cetera, as we described in the beginning?
Yeah.
How would you make sure that you're able to do what you have to do?
So that would be a case, if there's no family, then that would have to go through most probably a public administrator. And then usually what we do in cases like that, we would either do people free or Fested Shalemus, one of those two organizations to do it. What Hebrew Free sometimes does is they're able to do a little background check. They do like an ancestry thing. So if the person does actually have karka somewhere, we'll try to make sure that we can get them buried with their relatives in the karka that they have. If they need help with the money, now that we have the resources of people whom we can ask, so we'll ask them. Also, one of the directors that works with Hebrew Free, another good person in Flatbush, Rabbi Shmuel Hartman, also has been terrific, has helped out. Also, he'll do a levaya for, he needs makes mitzvah $1,800 for and then you have the cemetery on top of that. But we'll help out as much as we can in terms of yes.
I actually just recently I got a call in this exact position of no next of kin.
Mhm.
Funeral director was suggesting I call the public administrator, and not me, but the person who knows this person, to influence public administrator to work with as a friend of the family, and the person that sees would have wanted very much that she was control, but along those lines, does that make sense? That's
Yes.
the way to go about.
That's a good way to go about it, because also when there's a friend that's ready to step up, that's great.
And they'll say yes, like easily.
It might take a little time. That's the thing. You have to work, you're dealing with public officials, so, public office there, so you know how they work. They're always on their own schedules. But that's also why that disposition of remains form, especially if somebody has no family, and I can't tell you over the years how many people have visited in their 90s, and they just don't want to make arrangements. So this is a big thing, you know, if you could just, you could broach the topic very gently. You know, look, something, in case something happens, I want to make sure that you're treated with the utmost dignity and respect. You know, is it okay if we go through this and then we can discuss what it would be? You know, you don't have to do anything, we'll take care of everything for you. Or something like that, you know, and if the person does have money, if there's somebody that, you know, it's a tough, it's a very sensitive issue. I mean, you want them to be able to pay for it, you know, so you don't have to pay for it, and they have the money right there. Truth is also, when a person does is there, if the funeral expenses weren't paid, once the will goes into probate, the expenses for the funeral get paid through the will. So it does, but it could take about 2 to 3 years till that actually happens.
And not always with the will.
Correct, in that case,
They won't leave the will.
no, you're giving me a textbook case, mamish, because a lot of times when there is no, when there are no arrangements, there's no will, there's no this, there's no that, there's nothing. And whatever it's gonna be, then the money ends up back in the state, which is a big chabad, because the person, you know, the person has the needs, and there was one. Yeah. So, you know, but like Hebrew Free eventually would get, if they were to handle a case like that, eventually they'll get paid back, you know, once things are settled. So I wanted to just talk about one other area, if that's, time allows. I wanted to talk about the actual post-mortem care and to give you some ha'aras of what we do, what we're able to do in our hospital. Maybe you'll be able to implement them in your facilities. You know, I can say one thing, the Chasdei Hashem, at Calvary Hospital, they have been so accommodating to the needs of the frum community, but especially when it comes to Lachemir Esrim. And one of the things, you know, that I do is I literally am involved in preparing, when I'm in the building, I prepare all the niftarim and I transfer them. I do the hotzah together with the director to make sure everything is done with the utmost kavod. One of the things that we have is a Jewish protocols at death point. Every hospital has a different way of doing it. Now, what I mentioned earlier on, because we are an end-of-life facility, the death certificates are signed right away. We had a patient that was in our hospital. I remember this very well. They were there on a Friday, and they wanted to get more, you know, a higher level of care. So they coded them out of Calvary and they sent them across the street to Einstein, to the emergency room. And this patient this is a Friday morning, they were in the emergency room. And it was a winter Friday, I can tell you that. It was a winter Friday, and about 8:30 in the morning, they sent her across the street. By 11:30, she was Miss Paris. It took them till some point in the afternoon to get the death certificate signed. Whereas at Calvary, they would have had it done within 15 minutes. What was the nafkamina? She wasn't able to get buried before Shabbos. And they stayed by us. They would have been able to get, I mean, it was all the way Kadosh Baruch Hu wanted it. My point is that the hospital there, when it comes to a death certificate, okay, come, sign the death certificate whenever they're ready. But the most important thing is to get that certificate signed. I've been told that in New York, it's not ma'akev for the funeral home to have a death certificate to pick up a nifter or niftaris. There are certain funeral homes. Anybody that belongs to, for example, the Dignity Group or SCI, Riverside, and funeral homes like that, they will not pick up a nifter niftaris without a signed death certificate. That's the company policy. Or the private funeral homes will do it knowing that they'll get it done.
My experience is that some of the funeral homes, even some of the frum ones, will not leave their funeral home to pick the person up, to pick up the nifter and the parents, until they see the death certificate in the portal. They won't even leave to pick up.
Yeah.
Which I read that.
Unless you're really convinced them.
Uh-huh.
But you're better off convincing the doctor to sign the
You're
death
welcoming
certificate.
one on both ends.
Exactly.
especially if you're running late on a Friday. You work on
100%.
both ends. You make sure to tell them and you put yourself on the line. I promised him one time they took the body to the burial, and the death certificate wasn't there yet.
Wow. How did they get the permit?
Huh?
How did they
He
get the
said to me,
burial
it'll be over there. He's gonna by the
permit?
door.
Oh, they had it by the foot.
By the floor. But I put myself on the line. I promised him. I swore.
Wow.
Like he said, Chas Hashem.
Yeah, it's not the siyata d'shmaya that.
But if you look, there's no two flights. You can't.
No,
do it.
you can only, you can't mess this one up one.
Right.
This has to be,
Yeah, you're right.
that's permitted. So what we do by us, so that's the first thing, we make sure that certificate is signed. And I get calls, Motzei Shabbos, the funeral homes are calling me, you need the certificate, they can't get the grave open, or I have to get somebody there in Israel, or get, as soon as, or any time at night or day, whatever it is, they call me, and we make sure that it's done. And Baruch Hashem, when the doctor's not there, sometimes now the problem with the system is the facial recognition, so it doesn't go through right away. The certificate might have been signed, but it doesn't go through. So Chasdei Hashem, I have 2 contacts at the hospital, 2 nursing supervisors that are there all the time, and they know that if I can't get, if it's not, I call them, if you do me a big favor, can you push the death certificate through? He pushes it through, texts me back within 10-15 minutes, it's done. I call the funeral home, go weiter. So at least Baruch Hashem, it's, as was mentioned before, that you have to have the relationships with the people, and it's got to be a good relationship with the people that you're working with, because like this, they're able to help us out, and we do it back to them. So when I do the postmortem care, it's not only, it's also helping make sure that we give the covenant hames, but it also, I always tell the nurses, I'm glad it saves you about 20 minutes, half hour for what you have to do, and we take care of everything for you. So what they usually do by us, and we were able to work it out, they generally fold the hands like, Salem. They would tie the hands in the regular postmortem. They would take everything out, all the tubes, and then they wash the patient, they put it in a patient's paper stratum, they bring them downstairs to the refrigeration. By the Yiddish patients, that doesn't happen. Once this form goes in the chart, when the Jewish patients nifter, they call me 2 in the morning, 3 in the morning, whatever it is, if they're not coming, whatever. The only time, of course, Shabbos we don't pick up. But what they'll do is they'll leave the patient. When I get there, if there's an IV, I can take the IV out. I was taught how to take an IV out. Make sure that if there's any dam that goes along. Also, when a patient has a port, like a Huber needle, the hospital will not allow the patient out with that. So what we did is we trained with the nursing educator how to remove the ports, because that Huber needle, that's a very sharp needle. Some people have gotten stuck by it, and it's a big issue. So Baruch Hashem, they're self-locking, they have a safety lock on it. So we've been able to, they taught us how to do it. So we take out the ports, and we let the nurses know about that. The other thing is also, if a patient has narcotics, like if they have a fentanyl patch on, we have to make sure that goes in the sharps container. So we'll remove that, we'll remove the oxygen. They taught me how to remove a Foley catheter. So whatever I can do, but if there's tubing, the Plurex catheter that can't come out, so I work with the nurses to help to clamp it up and to tie it up to make sure we can do whatever it is so that the patient is as much Ayidei Yisrael we can do as possible, we do it. Now,
Should you tip the nursing manager? Yeah.
the fact that we're doing it for them is the biggest tip, because it saves them a half hour each patient.
But a lot of time,
Yeah.
yeah, with it. So we glue it, and we do in a way that you leave it there.
Yeah, no. Some of it's another like
Sometimes the patient comes and.
you leave some of them in sometimes, right? Because if it's like
Glue it, that it stays.
you glue it, you stay and you clamp it. That's it. I've done that. I had a case like that
We do
recently.
all the time.
Yeah, you
Never
do.
take it out.
But no, the port stays in, or sometimes you have the 2 tubes that are there. That stays in. You can cut, or you can, and then you clamp it and tie it in. I always try to make sure. By the way, no, we do give the nursing staff like gifts, or even donuts, even something like that, something that they appreciate. So that's always a good thing to do, to show you recognition. My car is I do that also very much with security. people because the security guards oversee all the hotels. So they know already, I call them, I tell them I'm coming down, they know the whole drill. I'm at the point, Liaison at our hospital, when a funeral director comes to pick up the nifter, they could be there for literally 5 minutes and they're done. Paperwork is, all they have to do is sign the papers. We do it, they call me, I arrange with all the directors, they call me when they're about 15 minutes away. I bring the nifter down, and then I put them in the car and everything. So we do as much as we can on Yidei Yisrael. So, just also we don't wash the patients. I make sure that the hands are by the sides, the eyes are closed. We put the patient in the bag and then we bring them down as soon as we do a direct removal. So the funeral home could either come straight to the room or we meet them downstairs, depending on when we're there at that point in time. Now, what happens Shabbos? So we offer two protocols, two options for the families. Either, it depends, and I tell all the families, what are the hadracha that your Rav has given you. So if the Rav wants to, some people prefer that the nifter not be moved at all. So our facility will let the patient stay there until up to about 24 hours. So I tell them within about every week I post the Shabbos times at the nursing stations. So I say 2 hours after that time. I'll call in after Shabbos if there's a problem. Give them 2 hours because you have to give the Chevra Kadisha time. I have to explain. Just because it says Shabbos ends at that time doesn't mean they're going to be here at that time. It means the person's going to get ready to go at that time. Or they get the phone call. So they come out, they'll do it, they'll leave the patient in the bed, the nursing staff will put ice on the patient, however, whatever have you, and then at the Shabbos, they'll do the Hotzah. Or what we will allow for them to do is they'll leave the Foley in. The only thing I'll have them remove is that if there's a narcotic, if there's a fentanyl patch, they have to remove that. If there's a Huber needle, that they have to remove. Everything else they'll leave in with the nifter on the terrace. They're not going to wash the patient, leave the patient in the gown. They'll put the patient in the pouch and bring them down to the refrigeration area. Should the family want to sit shmira outside, security will allow for them to sit outside, and I send this information out to all the nursing managers and the administration before Shabbos. If this case happens, if this is a possibility for over Shabbos, what would be? What happens over Yontif? Okay, over Yontif, if it's the last day of Yontif, I tell them to treat it as Shabbos. But if it's the first 2 days of Yontif, and especially if it's a 3-day Yontif like we just had with Shavuos, then I would tell them to follow the protocol and take the patient down. We also just gave out, there's a checklist of things when a person is nifter. This should be in also, if not, then I'll send it. Instructions for families at the time, or anybody at the time when they're in the room would see us neshama. So inform the nursing staff that the patient has stopped breathing. And I've done this before. Put a little piece of tissue under the nose. We take the oxygen off, put a little piece of tissue under the nose to see if they're still breathing. You wait about 20 minutes, sometimes less, and the doctor will come and they'll make the pronouncement. Just so that you know, the time, probably do know, the time of the pronouncement of the death certificate is not much the time the person was nifter, but it's also the time the doctor officially saw them. Close the patient's eyes and mouth, the arms by the sides, cover the face with the sheet. Any water in the room gets poured out. Open a window if you can. Electric Shabbos candles if you can get those. You contact the Chevra, make sure the death certificate's done and all that stuff is online. And so this way they can come, and then you can, if you have a shomer or the family's there, they can recite the Hillim by the nifter or nifteris. Yes.
I just like to add that what I usually do is I always tell the family that the deceased space is going to be covered, and I explain to them that this may be the last time because we're not going to uncover it. You give them like a little bit of heads up that within the next few minutes the face is going to be covered. If you want me to step out of the room so you have some alone time, or in general, just give them a heads up.
That's a wonderful.
No, after,
Yeah,
you can wait 15, 20 minutes anyway.
Yeah, they have to come in and pronounce. Yeah.
Is there any?
Ja, ich werde immer sagen,
Yeah.
nicht gestorben. He claims that he didn't pass away.
Before he passed away.
Before he passed away.
Transportation to move not his mouth.
Yeah, I understand.
That's
After
not-
the
that's
fact.
not-
I understand.
I mean, you could probably do it with
I
a
I
family
made the
member.
price. I haven't
They
done
don't
it.
feel,
Yeah,
we're
yeah.
telling them they can't touch, they can't do it.
Right, and
Tell them to do that, they don't feel.
what
bad.
what I also
Before
make
economic fields at stake.
sometimes is also I have them
Noch
come
nicht
with
Hilfe
me
kommen,
when
na,
we
komm.
buy.
Aber
You know, so they
er
can,
hat noch nicht
you know,
mehr
or
Wahl, wie
they're
er
helping
hat.
me get things ready.
When they see someone, you're removing, when
Yeah.
that happens.
Yeah,
Ich
yeah,
habe nicht mehr.
So
Aber
we're-
mir
they're
psychiatrisch
involved
steht.
in something.
to give them a little bit of involvement. But,
You know.
and also like,
Usually. yes.
one of the things also, I have a line that I want to share with the shlichim, you know, especially when you're doing the levaya. You know, when I tell people, I had once, they asked me about a patient that was, she was in her 50s or 40s, she had a 6-year-old and an 8-year-old. And the aunt comes over to me and says to me, explain to my niece what's gonna happen to her mother when she dies. So I said to her, this was mamish siyata d'shmaya, that HaKadosh Baruch Hu gave me these words, what to say. I told her, I said, if you think about it, I said, what they're going to do, I explained that the tachrichim are white. I said, if you think about royalty like a princess, usually you think of a princess, they're gonna wear a white dress. I said, she's gonna be dressed in white. And then what you do is, they're gonna put her in a special box and think of it like a treasure chest. And they said, when you have a treasure and you wanna put it away for safekeeping, what do? She said, you bury the treasure, and I said, that's what we're gonna do. We're gonna bury the treasure just for the time being until Mashiach comes. And the other thing, what I tell families is when we're about to do a kfura, I'm explaining it. Of course, I say this is chesed shalemes. I know the different shittas of children should take place and not, take part, not of the actual kfura. But I tell them that, you know, if you think about it, when we were children, our parents tuck us in at night. This is the last physical act of physical kindness that we can do for this person on this world. So we're gonna all take part in tucking them in together. And people, it takes off some of the sting, you know, the pain for having to do the actual kfura itself. And when people think about it, it also, when you have people that aren't as affiliated or used to the way we do a kfura, it also encourages them to do it a little bit more to help out. So it's more that at least you're gonna get the aron covered by Israel versus the cemetery workers or things like that.
That's not the, I'm saying, that's different than for itself. There, it is okay and appropriate with that they're involved.
I mean, or family members or anybody, no, there's different shilas about if a child should do it by a parent.
That's what I'm saying.
Right, I'm saying, no, you can encourage others.
What if it's the immediate family?
Immediate
That
family,
wants to touch and this, and when we're letting them close eyes, we're closing them.
so you can let them close, that's fine.
That's not an issue.
Yeah, that's not an issue. I mean, I have them, if they're okay with it, I have them help me in the room. So the
Different be saying on the kfura itself.
kfura itself is different, right, because the kfura could look like Chas V'Shalom, that the child might have had ill feeling towards the parent, it doesn't look nice. You know, because I asked the Shiloh by my father's Levaya, and I was told that, you know, better if I did not take part in the tour for that reason.
In the room, Adrab, it's very meaningful sometimes. The
Something,
family
right,
doesn't.
so sometimes I tell, you
Pour out
know,
the water, if you're comfortable, you can close the eyes.
exactly. So you give them things to do in terms of that.
Okay.
I can ask.
Yes.
that you're talking about, so already given,
Sure.
One new and one done.
What would be the sentence?
Denial, you were saying that you think that there's always divergence, which I appreciate that. Very often isn't, and it's just your imagination is the preconceived notions. But what about when there clearly is, you speak thereof, and divergence between their values and the other time frames values or whatever?
The best thing that, you know, I asked the Shiloh about this, you know, when I started working. And I asked him Schechter. And I asked him also about, you know, what do I do, Rebbe, if a patient wants, they tell me they want to cremate. So he said to me, you do whatever you can to educate. In the end of the day, you know, it's not your decision, but you as the Rav, you as the Shaliach, or whatever you're doing, it's your role just to at least give them, let them make the decision. So that's what I would try to do as best as I could, in terms of that. It's like when I say, like, for example, if it's burial versus cremation, I'm not allowed to go ahead and tell somebody, like, my facility does not let me say, you have to bury, you have to bury, you have to bury. I will ask them, can I educate you about,
Maybe more on like end of life care, that type of
yeah, then the life care, like, can I educate you about this? If you have questions about this, can we discuss the various, what we're talking about with the doctors and things like that?
thing. Is there a doubt that we should be aware,
Is there
a doubt, mistake?
every case is different, that's the problem, because every case is its own shaila, every case is its own unique, things to the table. There are people, let's say, for example, like if the family would want to be involved with Chaim Aruchim, okay? Chaim Aruchim is very helpful in terms of that, Rabbi Horowitz and also, Rabbi Lesson and the Dayanim, you could definitely also get in touch with them to see, or as I say, anybody that would be able to give you that guidance. Sometimes they might push one way, but you might get a little resistance for it, but hopefully not. We do our shabbos. That's the best we can do. And Halavai, we come out with a positive outcome. Yes.
There's a point in
I know in California, and I work with a physician in Los Angeles, and I think if somebody's on hospital here or someone's in the hospital and they pass away by the night or something like that, the nurse would call the physician, they would send me back to the body. That's normal.
That would be done, that can be done at home also, like if somebody dies in the house, that was, they would call a guy.
Like a hospital.
Yeah, the hospital person they call, but they sometimes like the families won't pick up the phone on Shabbos.
Oh, right.
So like I said, this is basically for the Shomer Shabbos families. But a lot of times, the families that aren't Shomer Shabbos, they'll have a non-Jewish funeral director come and they'll pick up the nifter on Shabbos. We do encourage them if they don't have to pick them up on Shabbos. It's better not to. But either way, that would be something that we have.
There's one other thing that, the physician, they told me that if a family, they want the connection, and that's what they wanted, and that's what they wanted. It's not, from their perspective, it's not your job to try and convince them and check if they don't want it. If they want it, then they can afford it, then you gotta help.
Right,
That's what he told me.
right. So what we do, B'derech Klal, often what I do is I just educate them so this way they're aware of it. 'Cause I can't, you all know, how many people do we meet that just don't know about it?
And it's usually looked down my son.
Exactly. Not from my side, no, especially if it's written in the will, then it's sorry about no, that's it. That's the way to do it. Yeah.
the 20 minutes that you had mentioned, if the person passes away either on a monitor or the doctor uses an EKG
Mhm.
in the current determination, does Halacha still say to wait 20 minutes?
I mean, Rabbi Zon told me to wait about 20 minutes just to make sure, but I don't think if you have definite proof right there and then, you probably don't have to, but this is just to make sure, even a few minutes just to see that nothing's starting up again. And then at that point, you'd be able to see.
I think it seems to me that all the contemporary books and publications that are coming out can keep on upping how long it is. First it was 15 minutes, it was 20, now I'm seeing books where it says 25 minutes, half an hour, all sorts of chumras coming out.
There's a nursing home that I know, in one of the nursing homes here, they managed to wait 2 hours. That's always been there, and this is, I've been affiliated with them for about now 15 years or so. Even 15 years back, they're still waiting the 2 hours.
The story that inside the article is on the body.
Yeah, no, but this way they make, yeah, well, this way they make sure, I think recently in Japan, there was a nursing home that sent somebody to the funeral home who was alive. But we make sure though, at least I know the people that I work with, they check and, they make sure that the person was lifted.
If somebody wants information, whatever, you can convince them, is there something to make it better? Is there anything to do with the Hada? Is there anything to do with better way or?
I've heard Mishnei Hatzadim. I heard that the Tahara really doesn't do much at that time, but I can tell you, I just recently had a family that they cremated the person and they wanted to put the ashes in a cathedral of all things. So he was married, never wasn't married to a Yiddish. But when I told them, they wanted the doctor to use a Jewish funeral home and they wanted a tahara. So they ended up doing the tahara. Some people they do it. I don't know if it might help it, but I guess that's what Shiloh, what about burying after a cremation? So my Rebbe told me it's pressure that's it's dust. It's meaningless at that point.
It's not metama.
Yeah, nothing.
No, you can bury that.
Well, before you can do it. I've seen it done. I don't know if I don't know if it could help in the show possibly. I don't know. Maybe anything you can do to help out. Why not?
I think we take 2 more questions.
Yeah. So it depends. So I was told for myself, I've been at Shas Yitzias Haneshama a number of times already, and I don't have any clothes left. So in a case like that, in our positions, you wouldn't have to tear kriya. Families, I've done kriya with families, mamish Shas Yitzias Haneshama, because they've been there. Others were told that there was recently I was in a home. Someone's house where the terrace was there, and their psak was the mentor kriya, the woman waited until the labay.
The general consensus from the Calvary teachers that I talked to in New York today is that even though Me'ikra didn't want should take kriya by the Shat Neshama, the fact is because Ein Rubikian, they just do a general thing and they're doing it by the Beis HaChaim, even with the very from family.
So that's how they're doing it, and I heard and then just recently one of the Rabbanim, I heard a shir, he said to this child, what time at the Kura, he feels to do it after the Hespedim. Some people do it before the Hespedim, but he feels this Rabbi felt to do it after this. We felt that the Shas Chimum after they hear the Hespedim is more. But generally, I usually do it before when Mesa Mutalafana, right before we do the Kura.
Which one do you suggest to learn more about this topic?
There's of course there's the Kobal Alavelis, there's the Mavri Yabok is a very good sefer to go through in terms of the Hagim and what to do B'Shas Maisa. There are a couple of medical halacha books that are out there. I have to check the exact names, but I'll be happy to go over with you some of them. There was the Dr. Abraham, he has a whole encyclopedia of medical refuah. It was also very good. That was one of the svarim that I was told to look into. And he goes through the Shofar for the various shilas that would come up. The article book, the article Avelis book, that's the Pnei Baruch in English, which is very good. That's also a very good guide. And now they also have the Levai itself. If you have the Magrich, also the cemetery book is also very good. Just wanted to close, and I appreciate it. I hope I didn't take too much time. I wanted to first of all thank you for this special schus. And I really hope that we could have this shutfus together. That we'll be able to. Everybody's welcome to contact me, and if there's any way that I can help out in your shlichus, wherever you are, it will be my absolute cover. I know that my friend and I we've been working together for a number of years in the city, and just one thing. One idea to leave you with, just end up with a quick board. That when Korach, we were just talking about, we said the board over from the Rebbe, but I just share something with you from there's a Marshav, one of the focus between Beis Shammai and Beis Hillel. It's better that a person was born, or better that a person which is better. So take a look at it. We have 248 mitzvahs saying, 365 mitzvahs losas. So the Gemara brings down the lashon of Nimnu the Nigmaru, that they counted them and they were going through the various mitzvahs, and you see the amounts of mitzvahs that you have. The Marshav says that if a person was just going to be by themselves and just be on their own in their own dalanamas, so it's probably tov shalom nivra adam, because they're not going to be able to do tshuva to work on themselves. because there's more opportunity to do Averis because there's 365 mitzvahs Losasei versus 240 mitzvahs Asei. But when it comes to doing mitzvahs with the cloud, what happens is that the mitzvahs that you do are also mitzvahs for the cloud. And you're helping build the cloud each time when you're going ahead and doing mitzvahs. The thing is that what Korach was doing, he was limiting himself. He didn't want to go ahead and really help the cloud. He wanted to get the cover for himself. He had what was called a mekafra. The whole idea of being shlichim, what you're all doing is you're going out. Not only are you giving over the, representing what the Rebbe taught, but also you're also representing the kilak tov nasati lachem, because it's through your beautiful avodah and hashpa that you are doing wherever you are to help these families and these yidden that wouldn't have this exposure. Their mitzvahs are your mitzvahs are their mitzvahs, and you're keeping on giving and giving and giving. The Eibusher should bench every single one of you and all of us, that we should continue to be Makadei Shem Shemayim B'Rabim. Rebbe's chus should be the approach should be chus Yagin Aleinu, and that we should Kazan one day to eventually have a different type of Kinus. When we'll all go out of business and we'll be celebrating together in Yerushalayim with the BSC Mashiach.